Today we are going to discuss an important topic, permanent birth control, options for women. Many women choose to undergo a procedure called tubal ligation, commonly known as having their tubes tied. It is a relatively safe procedure and it is certainly very effective for those who want to prevent pregnancy permanently.
It's Doctora Victoria and George.
To understand tubal ligation, let's briefly explore the female reproductive system. During ovulation, an egg is released from the ovary. The fallopian tubes serve as the pathway for the egg to travel from the ovary to the uterus, where fertilization can occur. During a tubal ligation, the fallopian tubes are either cut, separated and tied, or sealed shut to prevent the egg from meeting the sperm, thus preventing pregnancy. In some cases, both fallopian tubes are completely removed in a procedure called bilateral salpingectomy. Additionally, these procedures may reduce the risk of developing ovarian cancer in the future. Tubal ligation can be performed in different ways, depending on when it's done. Let's explore the various approaches. Laparoscopy. This surgical procedure is performed in an operating room at any time other than after childbirth. It requires general anesthesia, a small incision is made near the belly button, and a thin camera device called a laparoscope is used to view and access the fallopian tubes. The tubes can then be sealed shut using heat, rings, or clips. Mini laparotomy. This procedure is typically performed in an operating room using either general or regional anesthesia, usually within 1 or 2 days after giving birth. A small incision of 1 to 3 inches is made in the abdomen, and a section of the fallopian tubes on each side is removed. Mini laparotomy can also be performed in conjunction with another surgical procedure, such as a cesarean birth. Choosing a permanent birth control option is a significant decision, and it's crucial that it is entirely your own choice, free from external pressure. While it is not necessary to obtain your partner's consent for the procedure in the United States, it's important for both of you to fully understand the procedure, its benefits, potential risks, and alternatives. Some couples may consider male permanent birth control, known as vasectomy, as an alternative option. Your healthcare provider will explain the procedure in detail, including the options for anesthesia and the risk of pregnancy following the procedure. It's important to note that permanent birth control procedures should be considered a final decision, as reversing a tubal ligation involves major surgery and it is not always successful. Complete salpingectomy, the removal of the fallopian tubes, it is not reversible. If you think there's a possibility you may change your mind about wanting to get pregnant in the future, you should consider other long-acting but non-permanent birth control options. I've got a video here to talk about that. It is important to know that there are alternative birth control methods available for women. These include permanent male birth control, vasectomy, long-acting reversible methods such as intrauterine devices, IUDs, and contraceptive implants, and short-acting reversible methods like birth control pills, patches, vaginal rings, condoms, diaphragms, caps, or injections. IUDs and implants are effective as permanent birth control procedures in preventing pregnancy. While most individuals are content with their decision after a permanent birth control procedure, some may experience regret later. Factors associated with regret include being younger than 30 years old at the time of the procedure, relationship problems, recent pregnancy complications, and being in a new relationship after the procedure. If you fall into any of these categories, it is advisable to consider other birth control options and discuss the timing of permanent birth control with your health care provider. Permanent birth control procedures can be performed at any time during the menstrual cycle. However, having the procedure just after your period reduces the risk of potential pregnancy at the time of surgery. These procedures can also be performed after childbirth, abortion, or in conjunction with another surgical procedure. Before undergoing a permanent birth control procedure, it is important to use another method of birth control to prevent pregnancy. Condoms are the only method that also protects against sexually transmitted infections. Permanent birth control is highly effective in preventing pregnancy, but it does not provide protection against STIs. So that wraps up our discussion on permanent birth control options for women. Again, if you want to check out that video about non-permanent birth control options, check out here. Or if you want to learn some more about women's health, take a look here. It's important to make this decision for yourself, fully understanding the procedure and its implications. If you have any questions or concerns, your healthcare provider is the best source of information. Thank you for joining us today, our healthcare team. We hope that you'll join us next time. Bye-bye.
Bye-bye.